We are now in a global pandemic.
After 1 year with COVID, what have we learned?
We're serving anywhere between 7,500 and 11,000 meals a day.
The city partners with businesses and nonprofits to address food insecurity caused by the pandemic.
This is an essential part of giving back to our community.
New vaccine supplies bring optimism and hope.
I'm telling all my families that's over 60, get your shot.
These stories and more, next on CityStream.
Hello, I'm Enrique Cerna, and welcome to a special CityStream COVID crisis year in review. We're here at Seattle City Hall, where a clinic is providing the very precious vaccine that will end the pandemic. This is the culmination of a deadly year-long battle that has affected the entire world. Now, to understand how we got here, let's start at the beginning.
Today, Public Health Seattle and King County is announcing 3 new presumptive positive cases of novel coronavirus COVID-19, including 1 person who died.
He's referring to the nation's first coronavirus death. It happened here at Evergreen Health Hospital in Kirkland on February 29, 2020. Soon after, nearby Life Care Center became ground zero as dozens of residents and staff got sick. Brian Callanan, host of Seattle Channel's City Inside Out, explains the urgency of the moment.
According to the World Health Organization, we are now in a global pandemic.
Today I'm announcing steps to help communities contain COVID-19.
In what is now a national state of emergency, our state has shut down schools and promoted telelearning. Gatherings of more than 10 people are banned. Plus, our state is working to ramp up processing for coronavirus tests to several thousand per day.
As both the infection rate and fatalities surged, crisis teams prepared for the worst possible scenario. Within weeks, a makeshift field hospital rose from a soccer field in Shoreline. The temporary structure was built to treat homeless patients suffering from coronavirus. In Seattle, a similar mission was underway.
We are at the start of a marathon. This is not a sprint. It is going to take time for us to get through this. We know that this Army Field Hospital is going to be critical to the response here in Seattle. It will reduce the burden on our hospitals here.
As a military force, we conduct a wide array of missions around the world, but this mission is different. This is helping our fellow Americans.
We know that many of our hospitals right now are getting overtaxed by COVID, and we know that's going to be worse. We want to make sure that we can offload those patients to a hospital setting that is going to be safe and efficient for them. And so the goal of this hospital is to stand up that capacity.
Seattle was fortunate. Local medical centers were able to handle the caseload, so the field hospital in Soto was not needed. What was needed was more testing supplies to determine who might be infected. The state's director for COVID-19 response, Vice Admiral Raquel Bono, appeared on Civic Cocktail to explain the need.
What we were lacking were the swabs. In a large number of cases, it was the swabs as well as the reagent for the assays. So we have not only has the governor been very energized about making sure we can procure as much as we can, but we've also started receiving some of these supplies, these testing supplies, from the federal government, from the CDC.
And once the stockpile of supplies increased, more people could be tested. The city opened several testing sites with the Seattle Fire Department leading the way. Producer Randy Ng takes a look.
Today we're at our Aurora testing facility for the City of Seattle's free COVID testing.
Hi, how are you?
There's a great demand for this testing, and we've also figured out ways to dial in the efficiency and improve our capacity as we've gone. We've tested over 50,000 people now since we started on June 5th. We designed these sites with the expectation that they would test between 600 and 800 people a day in roughly 8 hours of testing. And our capacity has grown to as much as 2,420 tests between the two sites is what we did last week.
I think it's pretty important just to make sure that I'm kind of setting the example for people my age, especially right now. It's necessary. It's definitely something that we need in terms of access and possible being able to bring it into contact tracing eventually.
We are getting a lot of data out of these sites. I think a lot of times people sort of in Seattle shirk at the idea of giving over their demographic data, race and ethnicity and things like that, their gender. But this is actually very useful for us because it helps us identify areas of town that aren't getting enough testing. And everyone who's working here, we are providing them the best possible protection that we can. We're in a well-ventilated area. We're moving people through quickly. We've got good infection control processes so that we're not handling their items ourselves. And we're also not spreading infection from one person being tested to the other. We're very careful about that.
I'll hand you a vial. This is what you'll give to the firefighter up ahead.
I'm proud of these civilians, especially for stepping into a role that they're not used to.
Once COVID hit, our store closed down and I was on unemployment and I was just ready to get back to work. It's great. I mean, I'm here 9 hours a day. It's awesome. Everyone that comes through is so nice and just really thankful and really appreciative of what we do.
If you are having symptoms, you should get off the fence and get tested as close to the onset of your symptoms as possible.
If you can do it, please do it, because you gotta be safe with what you're doing right now.
I think we all want to look back on this time and know we did everything we could to try to bring the pandemic to a conclusion. And I really feel proud that Seattle Fire Department is getting to provide this volume of testing to the city.
But as the volume of testing increases, our service is reaching everyone, including communities of color. Also, special recognition for first responders as CityStream continues.
Welcome back to this special edition of CityStream. The pandemic has impacted every aspect of life as we know it. Schools are closed. Many of us work from home, if we're lucky. Thousands of our neighbors suddenly found themselves out of work as businesses shut down. The societal change was sudden, and the backlash to certain segments of the community severe. Brian Callanan explains.
Teresita Batayola is president and CEO of International Community Health Services. This nonprofit served more than 32,000 people last year across a system of 11 locations. Now, it's dealing with a worldwide pandemic that's challenging its limited resources.
The thing is, there is no cure right now, so it's not as if we could just write a prescription for people.
One top issue, ICHS says many of its patients with chronic conditions are not coming in for needed treatment due to COVID-19 concerns.
So we're trying to figure out different ways of providing the services.
Plus, ICHS is battling against a powerful anti-Asian stigma, as many, including President Trump, have connected coronavirus with race, ethnicity, or nationality.
We know that viruses do not discriminate. It has to stop. It does not help a public health crisis for discrimination and racism to be the order of the day.
Unfortunately, many businesses in the Chinatown International District became targets of racially motivated vandalism. But members of the arts community stepped up, donating their time and talents to help bring beauty to an otherwise ugly situation. Producer Randy Ng has more.
I was driving by Jade Restaurant and I saw that there were contractors who were hanging up boards on the windows, and I was concerned because I thought that the restaurant was closing down. So I stopped and talked to the owner's son. His name is Eric. He said that someone had broke out the window and showed me a picture of the broken window. I was worried that further vandalism would occur and people would think that it was closing down. And I wanted something aesthetically pleasing, not only for the restaurant, but for the neighborhood as well. So when people drove by Jade Restaurant, they actually wanted to go in. I put a call out for artists, and within 30 minutes, I had 5 artists who said, hey, we want to do something. The whole community of artists that came to help Jade Restaurant were from the Latino community, some who were even actually laid off from their jobs. They donated their time and their expertise to this project, and I'm really thankful. There was 5 different panels that they painted. None of the artists really had a concrete idea of what they're going to do. They had some sort of idea. And the last one, the J Garden panel, they actually kind of did that together, which is very reminiscent of the Gang of 4, where you have communities from all different backgrounds supporting our neighborhoods to make sure that we're taking care of one another. Eric, who is the owner's son, once again, he already expressed that he wants to hang the signs inside the restaurant once this is all over. As different communities we are hurting, we are feeling different levels of trauma because of this, and we're challenged by this. Our families are challenged, our children, and having something like this just gave us a little bit of hope.
Hope in the Latino community is built on trust. Trust that comes from listening to people. In a special Seattle Channel presentation of my podcast, Life on the Margins, Dr. Julian Perez talks about the disproportionate effect COVID has had on communities of color. He has an intimate understanding of the disease, having contracted it back in October.
What I think is that we need to find ways to reach out to the community and make them the experts, make them, have them tell us what the answers are. And we've begun to do that with these trusted advocate calls where we're looking at the community and asking them what's going on. And I term it el porqué. We know the statistics. We know that in the beginning, we're 13% of the population, 26% of the disease burden is when we were notified by public health because they were convinced that this was happening. We're up to now 44%. Of all the positive cases that have been collected in the state of Washington are among Latino community. So this is very concerning, and the trend is going the wrong way.
But why is that? Maybe because BIPOC communities contain a higher percentage of people who refuse both testing and the vaccine due to previous distrust of government programs. But organizations like Healthy Air Here are working to change that. Producers Roberto Romero and Randy Ng explain.
It is having ripple effects, challenging one's basic need stability. It's challenging one's access to physical health care. You can't even go visit your people at the hospital.
The COVID pandemic has put a spotlight on just how much inequity there is for people of color once they get sick. That's across the country and right here in the Northwest.
When you look at the data for the Seattle region, our outcomes data look great compared to other counties and cities in our country. But when you start to pull apart the data and look at it by zip code or different cities in our community, we are seeing our populations, our communities of color, being disproportionately impacted by COVID, having more positive cases of COVID as well as poorer outcomes when they get the COVID virus.
This is killing us. This is making us sick.
Communities of color have historically been misled, they've been mistreated, and in some cases, oftentimes harmed by the healthcare system. And so that leads to mistrust of government, mistrust of healthcare.
There's an assumption that just say the words and say the science and whose science, let's put it that way, and the other person hears it and accepts it.
Doing what is best, but at the same time wondering if that best is the best for who.
Contradicting messages in the news and on social media has muddied opinions to the point where many communities don't know who to believe anymore. As a result, many have adopted a wait-and-see attitude.
A lot of discomfort, a lot of don't trust, a lot of confused messaging out there about what is going on.
So it's very easy to say, oh, thank goodness, we have a vaccine now, let's move all of our attention over here. However, we are months away from the vaccine being widely available, and so it's so important with our numbers going up that we really stay in front of and maintain and increase the testing capacity. It's the only way we're going to contain the virus. But the data was telling us that Black and Indigenous and communities of color were not getting tested at the rate proportionate to how the virus is showing up. And so we really felt like we needed to do a better job than just the traditional mainstream messaging that was happening. It needed to really be tailored by the community and delivered by trusted community members if it was going to be effective.
African American, if you think doing a billboard is going to sell it, you better think again.
Implementing one of their slogans, people closest to the problem are closest to the solution, Healthier Here, through a grant from Gates Ventures, is targeting resources to specific sections of these close-knit communities of color.
We are a corrective society, community, so our leaders, we look a lot for information from people that are in certain places.
So in our world, we have found that if you want to talk to African Americans, or you want to communicate to Eritreans, or you want to talk to Ethiopians, you got to get into those nuances in a multimedia way.
Sisters in Common is a nonprofit social service agency that works with the Somali, Ethiopian, and Eritrean communities. They have found that their people like to talk using their phone apps. Knowing this, they created a community alert blog that can translate information into the languages of the people they serve and guide the conversations.
Word of mouth is more powerful, and so we leverage that to get to our people.
Teenagers Plus, also known as TI Plus, is another nonprofit helping to get the right messages out about COVID testing. For their mainly East African community connections, good old-fashioned conference calls seem to work best. Not everyone has a smartphone or a computer, so the easiest way to connect is to dial in.
We became visible because this is a safe place, and we are the in group, and we are part of that group. So we are as part of that, and they feel safer.
To me, one of the reasons we take great care and jealously guard our reputation with our community is because we have come to understand that there's memory. Trust matters. Respect matters. Collaboration matters.
The starting point is accessibility.
For months now, Healthier Here has been providing free, high-quality face masks to community partners.
They're essential. Yeah, not just important, they're essential.
Also essential, maintaining the trust. Once that is established, communities of color can take the lead in finding solutions for equitable health care for all.
Sisters will go out of business when there's no longer a need. When there's no longer a need, I'll be happy to turn the lights down.
Thank you. Thanks for everything you do.
For more than a year, healthcare workers have given their all to serve us. Many have worked to exhaustion and enduring emotionally draining shifts. Some have gotten sick and recovered. Others were not as lucky. Producer Ian DeVere takes us back in time when the world applauded our healthcare heroes.
A lot of healthcare workers get off at 7 o'clock, but the word around the street is that no one actually made it outside by 7, especially if you're a healthcare worker right now. So you wouldn't really hear it until about 8 p.m. So that's why we started it at that hour, so that people would actually hear it. I was quarantined in Paris. I was stuck there for a while, and at 8 o'clock I heard the entire city start to roar and all this applause and people opening up their windows, and I was like, what the hell is going on? And someone said to me, this is a way of applauding all the healthcare workers, all the people who are on the front lines, who are, out there saving lives. And I just thought, oh my goodness, when I get back to Seattle, I hope they're doing this. So I used whatever media savvy that I had and whatever following that I had from the theater world, and tried to push it into existence and make it happen here. And that's how it got started. really touching was hearing back from the healthcare workers and just hearing how happy they were. I tried to push it just for one day and then see if it took off on its own. It's not my idea, obviously, and it's not about me at all, but it felt nice to have a moment where the city could come together.
Next on City Stream, help for those having trouble feeding their families during the pandemic.
I'm standing in the same line they are. You know, I'm no better than no one.
COVID-19 has left 1.6 million people in this state struggling to put food on the table. The need is especially high in parts of Seattle and South King County. So the city has teamed up with philanthropic organizations, businesses, and nonprofits in an effort to battle hunger.
When COVID-19 hit our city, we started thinking about all the people who were going to lose their income. Everyone can understand that once that paycheck goes, you're thinking about where's your next meal going to come from.
We know how important food security is at this moment in time and will be through the duration of this pandemic.
Mayor Durkin wanted to get benefits to people immediately to make sure that they had food on their table. So we launched the Emergency Grocery Voucher Program.
Hunger is something that I think a lot of people can rally behind because everyone knows what it means or what it feels like to be hungry.
The program provides $100 a week for 8 weeks for families to use at any Safeway store in Washington State. We've now grown the program and we're now covering 8 weeks of groceries for 9,000 Seattle families. As we were able to grow the program, we partnered with community-based organizations like Via Comunitaria and others around the city to make sure that those benefits were getting in the hands of the people who needed them most.
It came at a very critical time, this collaboration between Via Comunitaria and the city of Seattle, because a lot of our families, our clients have lost income because of the COVID-19 crisis.
We've expanded our network and our growth, and we've definitely seen a huge increase in the number of calls and clients that we have.
Everyone around the community has stepped forward, whether that's philanthropy or business or other nonprofits.
Fair Start is a nonprofit social enterprise, and really our mission is to disrupt poverty and nourish communities through job training and food.
They saw a need and said, hey, we can connect what we do to meet the growing food needs out in our community.
Nourishing food, fresh food, scratch-made food heals trauma. We're serving anywhere between 7,500 and 11,000 meals a day, just any given day of the week. Right now, our community is also healing from this crisis, and we know that we have a role to play in that, and we're really proud to do it. I'm really proud to partner with the city and the Human Services Department to make that happen.
Thank you.
Take care.
The Senior Center was able to pivot and say, listen, we've got people who are going to go hungry if they can't come in to get meals. And so they really rallied support to get volunteers, to get to-go boxes.
The bags that you see here all have a name and an address on them.
And then to start moving meals out into the community and delivering them to people.
Food bank run, okay. So how many deliveries do you have left?
It's hard to tell you the way it feels when someone calls and says, oh, I'm going to eat today. And we really appreciate it because I didn't eat for the last 3 days because I'm afraid to leave my home. It's really essential. This is an essential part of giving back to our community.
The region's performing arts community has suffered greatly during the pandemic. Dancers especially have had a tough time with social distancing rules. But the Wim Contemporary Dance Group found a way around it. Producers Randy Ng and Ian DeVere have the story.
There is something about dancing outdoors in open air. It's just a different way of experiencing space.
We were rehearsing on a stage, preparing for a program in June. By about April, we realized that things were pretty bad, that we wouldn't be able to return in-person performances, and we decided to quarantine ourselves.
The whole essence of like touch and tactility and contact has been completely missing.
Not being able to be together with this group of people and able to touch was really hard. I missed it a lot.
And so right away we started thinking, so how can we keep creating? How can we continue to fulfill our mission as a company and as artists? So we created the pop-up. And the choreography is actually moving forward. So the dancers travel over a mile in 20 minutes while they're dancing. So they are never gathering in one space. And that way we never ask people to gather in one space either. Some people follow, other people watch from far away, other people anticipate, watch them pass by and going by. So that way we can kind of control that gathering aspect and that nobody clumps together, which is dangerous. And now we are actually in a household. And for about 4 weeks now, they're all living together, intense quarantine, nothing, no friends, no outside, no walks.
Just so that we can stay safe and as isolated as possible.
Creating that bond creates the trust that allows us to go forward.
That way they can actually touch and dance together. We've all been quarantined at home. The fact that we're able to bring dance into people's life this way can be really inspiring.
Being able to move our bodies and that we still have that ability, I think is really powerful.
It's art, it's communication, it's telling stories. It's a very sort of like personal essence that we've all kind of been deprived of.
Going to be 40 strikes of the bell today, and they represent the 400,000 people who have died in this country and the 4,000 in Washington State. So it really just represents our loss as individuals and as a country.
As we mark the grim toll of the pandemic, we're reminded a brighter day is ahead. Thousands of people in our area have already received vaccinations, and a third vaccine manufacturer has just been approved. Soon, millions more doses will be on the way to cities and towns across the country.
This site at Rainier Beach and our West Seattle site where we were last week are being converted into fixed testing and vaccination clinics. That means that each of these will be able to operate weekly with the doses we get. That's between 1,000 to 2,000 people per week. Once supply ramps up, we estimate that we can do as many as 1,000 people per day at each of these sites.
We've lost more than 1,300 people in this county. But we have also saved thousands of lives. And when I say we, I mean all of us, all 2.3 million of us together doing the right thing, have saved thousands of lives.
It's a bit more protection, but I also know that I need to continue to protect myself. Even with the vaccine, I can't relax.
I'm telling all my families that's over 60, get your shot.
And we end with some good news. Despite being the nation's first coronavirus epicenter, Seattle continues to have the lowest cumulative cases among the top 30 major U.S. cities. On this graph, Seattle is at the far right with just 26.5 confirmed cases per 1,000 residents. Still, remember to wear a mask and practice social distancing. And on that encouraging note, that wraps up this special edition of City Stream. I'm Enrique Cerna. Stay safe and stay healthy. Thanks for joining us.